Hi, welcome back to my channel. Today on Stasia's Journey, we're going to talk about physiotherapy with my favorite, well, one of my favorite, but now she'll kill me, physiotherapy Chana. So I met Chana here at Mandeville Regional Hospital, and she's very passionate about what she does. She's such a sweetheart, and then, you know, our relationship grew, so. And then
she's my favorite doctor, well, one of.
No matter the people that kill you.
That's right.
So yeah, we're just gonna talk about physiotherapy. Today, by the way, is physiotherapy day when you're watching this. So just to bring some awareness to the area of physiotherapy. All right, so let's get into it. All right, so the thing is, a lot of times when people think about medicine channel, they think about doctors, nurses. They don't think about these other fields like physiotherapy. And there are a lot of times I have patients that come to me and I have to refer them for physiotherapy. Like one of the things is, which you never really think about, I think, is PVD. And they need the stockings, peripheral vascular disease, you know, problem with circulation, and they need the compression stockings. And it's a physiotherapist that helps you to fit and get the measurements and get the proper fitting. So physiotherapists, and that's just very small, but very important. Very, yeah. And the quality of life you lead when you have burning in your legs and you can't walk properly and the varicose veins are bother you, you know, those things are very, very detrimental to your health. So we're going to talk about physiotherapy and get into the importance of it and all that. So my first question to you is, what is physiotherapy?
Well, basically physiotherapy is a treatment of disease, injury, or deformity that helps prevents patients from just doing simple tasks such as standing up, moving from bed to the chair, and those tasks. You want to help to prevent further injury, prevent the onset of further disease, and get them back to a more functional state.
So basically, ensure that they lead as normal as possible, quality of life.
What life was like before the injury, and get them back to even more optimal state, functional state after getting them to the whole rehabilitative process.
Okay, all right. Okay, so it's to get them back to a normal state of life. So why is it so important? Can't any other area of medicine do this?
Well, I mean, I don't want to touch on anybody's toes, but not all disciplines will tend to listen to do detailed assessment, find out the root cause of the issues. I mean, you patients with injury, person just having a fracture to your wrist, they might not be able to open a button and unbutton your clothes, pull on your shirt, pull on your zipper, feed yourself, simple tasks like that because of the injury. So if you do a surgery, your hand is being immobilized for a period of time, you lose range and joints, and physiotherapists have to come in, assess.
So range of joint, you mean like, for example, if me they hear something, I try to touch that, we can't do that. You just can't go right.
Bring it to your face to drink some water, simple tasks like that.
But I feel like a lot of us don't even think about these things until they happen to us.
Right, and that's when you have an injury, that's when you report that one side of your body is as important as the other side.
Yeah, or one finger sometimes.
The reason why you have 5 fingers and not one versus 2 hands and not one.
True. And I think a lot of times, this is what I've noticed. What medicine can't fix, we do treat the symptom of it.
Right.
So physiotherapy is about ensuring that you get to the root cause. All right, so that's why it's important, and that's what it entails, going to the root cause. So give me an example. A patient comes, like for example, my situation, I fell and I hit my back, and how do you go through an assessment?
First of all, you take a detailed history, so you listen to the patient, find out about the present complaint, what happened, the mechanism of injury that the patient felt.
Mechanism of injury, what that means?
In terms of where you're walking, you slip, you twist your knee, you fell on the knee, you fell with the limb outstretched, you fell sitting on the limb. Did you have any swelling? What happened? Where you went from there? What did you apply? So you want to know if the patient applied some home remedy that would have increased the swelling or increased the inflammation. Did they do an x-ray? Did they know what is happening to them? And after you take the history, you do a detailed assessment. So you assess, if it's the elbow, you're not just assessing the elbow. You assess joint above and joint below. Assess the shoulder and the wrist. Based on your assessment findings, you do like special tests to say, okay, is this a muscle? Is it a nerve? Is it a tendon?
Right.
Is it the bone? To rule out and say, okay, because sometimes the doctors might refer the patient to see, for particular conditions, but based on our assessment, we're like,
it's something else.
Exactly what is happening with the patient, or it could be a combination that they might have missed because through the detailed assessment. So after we assess these patients now, we deduce the problems, what we call physiotherapy problems. So based on our problem, it doesn't just stop there. Based on the problem, we have to write goals, short-term goals and long-term goals. How much sessions are going to take to improve like range of motion, finger is unable to straighten, how much sessions will it take for me to get this finger to be straightened?
Right.
Is there decreased muscle strength? How many sessions required for me to improve the patient's strength? Pain management in terms of I might opt to use modalities or if the patient stuff to do at home.
Right.
And based on these goals that I set, the patient in themselves has to have goals for themselves. Because you might say to your patient, okay, increase range of motion, but that's not effective to the patient. They don't know what that is. So you have to ensure they have functional goals.
Right.
Do I want to be able to wash my clothes? Do I want to be able to comb my child's hair? Do I want to be able to lift my handbag again in my hand? Those functional goals are important. You need range, you need strength to do all of those activities.
Basically, you go to their level.
Right.
What they would need. Okay. Anything else to add to that?
In terms of what we'll do?
Yeah.
So generally, a course of physiotherapy is 6 sessions for like cases that are like fractures, weakness, sprain, but in terms of a long-term physiotherapy would require more than 6 sessions would have been a course. Like for those with stroke, you know, it takes a longer rehabilitation process. And we want to also involve the caregivers, involve the patient. The patient ensure that after
support system.
Right, that is very, very important because if the patient doesn't have anyone, the patient might have cognitive function, not being able to follow commands, and we as a clinician will educate the caregivers, educate the patient, give them home exercise program for them to follow to do at home.
Right.
Right. So we have to involve the caregivers to help the patient to get to where they want to be. Understand that we might want this for the patient, but the patient themselves have to want the same thing
for themselves. So basically, it's passing that mental barrier, ensuring that you and the patient are on the same page. We see that in curative care as well, in the sense of the patient have diabetes and they don't care to get better, so they will not take the medication, they'll not get better. In your case, it's they'll not do the exercises, so they'll not get better. Right?
And as you mentioned, diabetes, as physiotherapists, we just like we write medication, exercise is a prescription for a certain population like diabetes, hypertensive patients, persons with heart problems. As a physiotherapist, you can prescribe exercises, we do exercise testing before in terms of their patient's resting heart rate, the mode in terms of what type of exercise that we would prescribe. And so the patient will come back to the doctor, they do their GMR, it will be within a normal range because of exercise. Because exercise does help with just about every single condition that you can think of.
Of course.
I can't really think about one condition that exercise
can help with. Somebody says to you, they're watching this now and they're like, okay, I might need physiotherapy. Where do I get physiotherapy?
Well, currently, physiotherapy is offered in like the hospitals, and persons have private practice in primary healthcare, like health centers. We won't find a physiotherapist there, but I heard that there's work in terms of getting persons to first-hand care. The person that in their community they need physiotherapists, but most of the time they have to go to the hospital and take a longer process because there's not much physiotherapists in the hospitals to help them with. Right, but we do need a referral. So the patient has to get a referral from a licensed medical practitioner, a licensed doctor. However, for example, if in terms of a sports therapist or a person that have a physiotherapist that is a part of a sporting team, patient that can come to you and they tell you that this is happening with my knee. Again, you take a history, you do assessment techniques, you do special tests to rule in or confirm particular diagnosis. Then we'll make a referral to write a progress report to a doctor, required further investigations such as like X-ray, MRI,
CT.
And then we can see the doctors. After we get their X-ray, the results of those tests, then we'll say, okay, confirm the pathology or rule out or to see what is happening with
what the issue is. Understood. All right, so basically you're saying they must go to a doctor, say, oh, I have this, that, and then the doctor refer them. So that means the doctor should also see the importance of physiotherapy and not just give pain medication and not just give a rub. You get what I mean? And then say, oh no, you need physiotherapy.
Because I'm glad you mentioned that, because most of the time this person will be having like, go to the doctor, I am having pain in my back, doctor. And you go to the doctor, okay, they prescribe some analgesics. 2 months on the line, still having pain.
Analgesics again.
And
analgesics mean pain medications, right?
So 1 year, 2 year, patients still getting painkillers. And then it's not until like maybe 5 years, 10 years down the line, at that point in time when the patients could have gotten physiotherapy to help to prevent further injury, the patient is coming at this point in time when they could have prevented getting surgical intervention, and sometimes these patients tend to develop other complications. Maybe they are hypertensive, they have diabetes, poor circulation, other conditions that would put them at risk for getting surgery. And this person at that point in time, when they come to physiotherapy, it gets so intense. For example, like it's arthritis in the hip, there's a lot of degenerative changes going on.
Okay.
So at that point in time, you cannot do surgery, and we only could assess with conservative management at that point in time, and sometimes because the damage is already done, we can't get the patient back to a more functional state, so they have to live with that for the rest of their life.
Can I say something though? What I'm seeing a lot, because today is my last day in health center, what I'm seeing a lot though, if we were to refer everybody, we couldn't manage.
I know, but I mean, if we, as a clinician, we want to put the patient's best interest at heart, because
so refer them.
And we should all try to lobby for getting more physiotherapists, because you need physiotherapy pre-op, post-op. You always will need this thing, and we want to.
And just for lifestyle.
If we have a lot of patients coming in, because
the need will be there.
Educate, right? So we go to a less strain on the healthcare facility.
That's true.
Resources and all
and
that.
And the pills when they needed, them would have learned.
But they have to come and get at the hospital. We have to pay for these things.
Right. So this is the reason why I'm doing this video, because a lot of times I want to refer a patient and them tell me, say, me go physiotherapy on top because that not help me. And I'm like, no, you have to keep going. Right. You have to keep going. So a lot of times I'll be referring people, and then they just be like, I don't want to go there. I've been there before. Oh, my mother did go and it never helped her, but they're not understanding you should continue. So they don't want to be referred a lot of times too. So that's why, you know, to educate the public, to help them know that physiotherapy is so important. And then a lot of young people will meet in, you know, will have some sort of pain or whatever, and they ignore it because they're young.
Right.
But what about when they get older?
Yes, because you would have been having this pain from early age and you pain in the mind, so as I said, you get progressively worse over time.
Right. So physiotherapy basically puts a halt in that.
Right. And a lot of times, a lot of persons, I remember I was asked before by a public health nurse if physiotherapy is a part of the Ministry of Health program, which still goes to show that there's a lack of awareness.
Even in our
this time and age.
Even in our sector, like the health sector itself, does not understand that physiotherapy is a part of it.
And it's until they hear about some cousin or somebody that they know have an injury and they hear, oh, this is what physiotherapy is. And most of the time, you have patients, they will be on the clinic, they came one time, like I said, you have to understand, explain to the patient, education is very, very important from the initial assessment. Explain to the patient that if you don't do this, this is what's going to happen.
Right.
And it's not all on me, because in the public system, patients are not coming weekly, twice a week, 3 times I would want them to. So they may be a 2 months appointment, 3 months appointment. So they have to be continuously doing these things at home. And if they don't understand that, they might not do it. And sometimes patients are referred, they come one time, they don't come back. And then sometimes, maybe 6 months on the line, they'll come and say the doctor said. So it's only if the doctor said that they should come for physiotherapy, that's when they
So it's important that the doctor and the physiotherapist or the physiotherapy department work together, that the doctor is encouraging physiotherapy.
Education and awareness, right.
What are some of the tools that physiotherapists use? Saying it out of the frame.
One of the major tools that we use in terms of these are goniometers. So
they're what? Say it slowly.
Goniometers. Right. So they work for different joints. So for example, this size would work with the wrist. So we measure, put it different in terms of how we align it. We have
do a demonstration.
Moving arm and a stationary arm. And we want to measure
wrist. This way so they can see.
We want to measure, it will be on the other side, the side of the little finger though.
Okay, the side of the little finger, alright.
So we want to measure wrist extension. So we put the fulcrum here and the ulnar styler process. Then
tell me.
The stationary arm is here in alignment with the forearm, and the moving arm goes here. So we want to put the patient in a neutral position. Then we ask the patient to extend the wrist. We want to bring the fingers like toward the face as far as they can. So if it's that patient is able to bring it, because for each joint there are normal ranges, right? So we'll know if the patient is unable to take it to the actual range. So if the patient goes here first and they're having a lot of pain or it is stiff, as a clinician will apply some passive stretch to bring it safe, can get it to the end range. Right. When we do that, we feel the end feel to know if it is hard. if there's a lot of bone growth there, or if it is firm, which means that you can take it more, which means that the patient can get more range in the joint.
Which that's when physiotherapy would help, because if it's bony growth, then that would be surgery if anything.
At the site of the joint.
Right.
So different size, as I said, used for different joints. This will be used for like the knee, the shoulders, and the hip. These will be used like for the ankle, put it on the ankle, as well as this one. So different. So the goniometer is also used. We use a hand dynamo.
You know what they remind me of? You know when they get a geometry set?
Right.
Yeah.
So this is like a hand dynamo. He measures grip strength. So we would generally put it at 0. We measure right and left, because we always compare the affected side, which is the side that it has the injury on, and the unaffected side.
Right.
And we allow the patient to turn, focus, bend the elbow, and they're going to squeeze as hard as they can. So it actually is an objective measure of how much grip strength. Now, the persons like with sprain to the wrist, fractures to the wrist, and they can use the hand to help them in terms of self-care tasks, performing hygienic needs, that kind of stuff. Will measure their grip strength. And also with stroke patients, because weakness to one side, the wrist might be dropped like this and they can't lift it up, so we want to measure their grip strength. So we, based on what we find on the first day, we'll compare the right and left, and we see how we're going to we set goals. So in 2 treatment sessions, we want to expect to get by 5 to 10 kgs or pounds, increase the grip strength. So based on our intervention in between, we'll reassess, and see if our patients are improving.
Understood. Wow. Right. I am learning a lot.
And this is just a small aspect of it. So all this cannot be explained in one day.
And not only that, you guys have, first of all, I want to go to university for this, so clearly it can't be explained in one day, but it's to bring awareness and to explain the complexity of physiotherapy, so we understand that it's there, it's important, and it's needed. You mentioned earlier that most times it's 6 sessions. Does physiotherapy though ever end?
No, it doesn't, because for example, if it's that I have a fracture and I was unable to move my hip, right? And I get physiotherapy, and based on the assessment, like I said, and the patient is no more functional. So initially I couldn't walk, I couldn't stand. I used to play a sport and I was unable to play it. And after physiotherapy, I was getting like a course of physiotherapy. I was able to go back to where I was before, playing my sport and moving around without any assistive device. But after that, because you had a fracture before, you know that your wrists are getting re-injury. So you have to continuously ensure that you strengthen the muscles around the joint. Try to do your stretches, because if you don't stretch and the muscles get tight, you maybe have difficulty even just coming off the bed, standing straight, walking with a limb. The physiotherapy is never ending. Everyone should be engaged in exercise on a day-to-day basis, because these things help with your oxygen levels, your heart rate, and prevent you from getting other injuries, comorbidities like high blood pressure, diabetes. It's good to have an active lifestyle.
So are you saying then that an active lifestyle helps to prevent you coming to see the physiotherapist?
Prevents you from coming to see the
I'm not talking about if you drop and whatever, but you know, if you drop, you drop.
Right.
But how does an active lifestyle before you get an injury help you?
Right. So for example, if you're inactive, your muscles are tight, you're not so flexible, you're at risk for getting injury. So you might walk over there, your feet, you're unbalanced, you can walk and you fall. So is that even though the patients can come before to prevent them from getting injury, prevent worsening of a particular disease or condition, and to prevent awareness, educate other persons. So you can educate, when you educate these persons, they do these exercises before. So even though they might not because they can have an injury for the shoulder, right? And just educate them about exercise on a whole, based on their age, reduce an exercise program for them. They can prevent them from coming back with another injury.
Right.
So they are aware of the importance of exercise, so they'll prevent them from coming back. Not just them, but persons in their household, persons in their communities.
Right.
Right? So you don't have that heavy burden.
That's true.
On the healthcare system.
I've noticed, so a lot of older people, when they fall, they get hip fractures. And you guys have to help them to ambulate again and all of that. I've noticed that there are old people, who, when they exercise and they fall, they don't get the hip fractures.
Right, because when you get older, the whole osteoporosis, decreased bone mineral density, especially for females. So if you're an active person and when you get older,
the bone is stronger.
The bone is stronger, the muscles are stronger. So if you walk and you fall, you're less chance of getting a fracture at that point in time.
The bone is stronger, right?
So if you encourage an active lifestyle from your young, and you continue with that throughout your adult and your older age, then it's better for you.
Okay. The last question I wanted to ask you in this session is just list the main things that you see as a physiotherapist. Because I don't want people to leave thinking that, oh, what I have is not, physiotherapy is not needed, but so they can understand that, oh, maybe I need a physiotherapy.
Some of the major conditions that
I know you said everything needs physiotherapy, but
something like carpal tunnel syndrome for those who are secretaries or receptionists that continues a lot of typing, and writing, wrist pain. They start to have numbness, clumsiness in the hands. This person, if you educate them before, let's having a lot of education sessions, take breaks in between your tasks. Now they start to have a lot of numbness and things. They cannot hold anything, cannot hold a little bottle to open something. They have to do surgery. If they are educated about these things before, they prevent them from coming to do surgery, because sometimes they do medial nerve release in terms of the hand, and after that it gets worse.
Right.
And they have to come back to physiotherapy. So before they get in physiotherapy, after. So carpal tunnel syndrome, babies, children are born with cerebral palsy, in terms of the brain not being fully developed, and so they're unable to creep and crawl, because children at a certain age, they start baby is born, they're there just resting, and over a period of time they should be able to creep, they should be able to crawl, they should
different milestones.
Right. But because of this condition, they need physiotherapy right across. Because if not 2 years old, 3 years old, they still can't do these things. And it's good to start them off from early. A lot of conditions, fractures,
stroke,
spinal cord injury, tumors, and that has to be resected. They have to start a whole rehabilitative process again. From your shoulders, the neck straight down to your toes. They can't do simple stuff.
Any fall, you drop out of one tree, you drop off a ladder.
And it's the thing, not just that.
What a sprain?
Prolapse.
Vaginal prolapse.
Incontinences, all those things.
Really?
Strengthen the pelvic floor muscles. Arthritis, very, very common. Arthritis in the hip, the knee, the ankle, rheumatoid arthritis involved with that. Arthritis basically involved with more than one joint. After those back pain, chronic lower back pain is a major thing, because persons are not aware of the correct lifting technique, improper posturing when standing, sitting, just doing about any other ADLs on a regular day-to-day basis.
Any other what?
Improper posturing in terms of
ADLs.
ADLs, which is activities of daily living. The regular day-to-day things that you do on a day-to-day basis. Make a breakfast, clean your house.
Anything will hinder you from doing that, you need physiotherapy.
And it's just over the time, if you're not lifting properly, back pain can come. You can lift something and hear crooks in the spine, and you don't want to wait until 10 years down the line. Those persons, higglers, farmers, they have a lot of loading on the shoulder, we have a lot of rotator cuff injury. Over time, the wear and tear in the muscles, have a lot of pain with that. So those are some of the main things that we see.
I mean, no, you can't continue, because clearly you see
on. Babies with Erb's palsy, when the babies are being born, the shoulder, they have the kind of decreased movement and
shoulder.
And the shoulder. So they want to start from early, because the better outcome if these children are starting with physiotherapy as early as 2 weeks old, 3 weeks old, thereabouts.
All right. So just to switch gears a little now, somebody said to me that their child wanted to do medicine, but when she saw the cost of medicine, she's like, no, but he's a science person, and he wanted to do something in the sciences, and she told him to go research, and about, the medical scope, and then he found out about physiotherapy, and he's like, whoa, I want to do this.
It reminds me of myself.
And she was like, oh, what if? And he did it, and now he has his own thing that he does, and his own private patients and stuff. So if somebody is watching this and they're like, oh, but my daughter or my son could do this, what are the steps? So clearly, high school, you do the sciences, fine. What are the other, what do you take? What are the steps to take from there?
And no, you do not need physical education, because it is physiotherapy. We do not use PE as a course or a subject to get into physiotherapy.
That's usually a misconception?
Right.
Okay.
So in high school, you need sciences, physics, chemistry, and biology. In sixth form, you need bio or chemistry and physics or maths.
Okay.
Can be substitute. They need to do a total of 60 hours at a preferably 30 at a private and 30 at a public, or all 60 hours can be done at a public hospital, because it's best to get more experience.
This is in high school or in university?
No, you have to do it before. You have to do it before, during
university. Okay, all right. So you have to do some voluntary
60
time.
hours.
Okay.
And that's about it.
And then you apply to the physiotherapy program.
Submit your hours, and then you.
Which is a part of medical school, right? So you apply to medical school.
It's a part of medical science at you. It's not about a part of sports faculty.
Right. So like it's right. So you apply to medical sciences.
Right.
And okay. All right. And then you get through.
And after you get through,
how long is how long is the course of study?
Well, the course is 3 years.
Okay.
It's supposed to be about 4 years, because it's a lot of tedious work. You have to learn a lot of stuff, because you basically learn everything. You have to learn
anatomy,
prescriptions, medicine,
right?
Everything. You have to learn about pharmacology, biochemistry, everything. You go in depth into everything.
Right.
You need to go into.
Right.
So it's not. You have to be well rounded.
Understood.
You have to understand what these labs are saying. You have to get a detailed assessment.
The imaging, understand what was looked at and all of that, yeah.
Because you have to do a lot of manual techniques, soft tissue mobilization, joint mobilization. You have to understand where the nerves are, the arteries are. Because you're going in, using your hand, going into detail.
Right.
How to read imaging, like X-rays, MRI, those kind of things.
Okay. Okay. So this is the way somebody can get into it. What are some other fields that physiotherapists can? Say one day you take yourself and you say you don't want to do physiotherapy anymore. What are some other fields you can easily segue into?
Well, you can become a lecturer. Most persons in health, they tend to move on to what we call it, like epidemiology, like the one in terms of like disease,
right?
They manifest and all that. First tend to do that. Physiotherapy is broad, because if it's that you like working with children, you can focus in pediatrics
or geriatrics.
Right. If you like sports, you can focus in sports medicine.
Okay.
If you like neuro, you can do become a neurophysiotherapist. Women's health, pelvic floor. You can focus on
different branches.
You can find your niche, because it's very, very wide.
Okay.
You can, if you like say plastic surgery, you can go in and do work a lot of lymphedema,
right?
All those in terms of the massage, the scar tissue mobilization, you can focus on that. You can focus on hydrotherapy. You're a person that likes aquatics, because doing exercise in the water, if for example, if you're not so strong, the buoyancy of the water, so it's less
takes the pressure off the
and persons
joints
progress
and
that from water to land is easier for the patient to start with. Persons specialize in that. There's so many different specialties that you can focus on. You don't have to, you can do physiotherapy and you decide that, this is not for me. You can move on to doing other stuff in healthcare field as well. So thank you so much. Thank you so much, Physiotherapy Channel, for my pleasure. Educating us. I have been enlightened. I really hope you have been enlightened. And today, Physiotherapy Day, just support our physiotherapists and understand more, just to understand more about it. I hope you have learned. So thank you for watching, subscribe, comment, like, and we're on the road to 500 subscribers. Thank you guys. So until next time, bye.